Hello friends, this is Dr. Nikita, National Level Radiology Faculty and your NEET PG FMGE mentor. So first of all, thank you for the appreciation that we have got for the recent video, that is cheat codes for NEET PG. If any of you have not seen that video, it's my sincere request and advice to watch that video. It will be very helpful in the exam. So after that video, we have got queries from the students regarding how to solve lengthy questions in less time in the exam, because lengthy questions are the ones which take a lot of time. Even I had faced that difficulty in my All India exam, All India MD M10s exam, and that is one of the reason that I could not score well in All India exam. So I realized from my mistake the what went wrong, and that is what I would like to share with you, the trick to solve the lengthy questions in less time. This trick really helped me in the later exams, be it my state entrance, AIIMS or PGI exam. And this is the trick you can really use to solve the lengthy questions in less time. So here we go. So the most important trick to solve lengthy questions is always start reading the question backwards. That is, if you have an entire question which is 4 to 5 liner question, start reading the question from the end. What is the question trying to ask? The end thing would be, what is the most likely complication? So then from the options, keep the question is asking what is the most likely complication. So for that you need to make diagnosis from the previous, like in the 4 to 5 liner question. The question, the last line would be what is the most likely diagnosis. So from there you need to take the clues from those 4 to 5 lines to make the diagnosis. So start reading the question from the end so that at the first go what is the examiner trying to ask. So let me explain these with some examples. So this is the best example to read the entire question, but if you follow this trick, that is, it will really help you to solve this question. So the trick is, as I said, start reading from the end. That is the last sentence after your full stop. So the last sentence is, compared with amniocentesis, chorionic villus sampling may place the patient at greater risk for which of the following. So you get the crux of the question from this last line itself. That is, what is the complication with chorionic villus sampling, which is more as compared to amniocentesis. So if you get this question as a one-liner, we all know that the answer to this is fetal limb defects. So that is the most important thing. Chorionic villus sampling poses a risk of fetal limb defects. So now even if you don't read this such a long question, the history which is given in that, it really does not matter. Just reading the last line, you can solve the question, and this has saved your 5 minutes minimum, which you can utilize to solve rest of the questions. So this is the best example of a long question. Now even if you read this question, this is 46-year-old woman, the obstetric history is there. Then she comes for first prenatal visit. She has nausea, vomiting, no other complaints. Obstetric history is significant for 3 full term. No medical surgical history. Now it is a 8-week sized uterus, but otherwise unremarkable. And she wishes to have chromosomal testing. And she wants to have chorionic villus sampling. Then compared with amniocentesis, what is the risk with chorionic villus sampling? So actually this history is not needed at all to solve this question. Just the last line will help you solve the question and save time. So please remember the trick for the long questions. Read it from the last sentence. It will really help you. Going to the next example. So again you have this really lengthy question here. The trick we said is start reading from the end. Which of the following lesions would this patient most likely also have? So here you do not know what is the diagnosis, so that you can mark the answer. So first you need to know what is the diagnosis. Look at the options: acoustic neuromas, berry aneurysm, cortical tumors or neurofibromas. So basically from the options you can guess that the question is trying to ask some neurocutaneous syndrome, because neuromas is NF2, cortical tumors is tuberous sclerosis, neurofibromas NF, neurofibromatosis. So this is related to the topic of neurocutaneous disorders. Go to the second last sentence. Pathologic examination demonstrates a cardiac rhabdomyoma. We all know that cardiac rhabdomyoma is seen in tuberous sclerosis. So now we have already made the diagnosis. So which of the lesion would be seen in the tuberous sclerosis? It is cortical tubers. So just reading the last two sentences, you can answer the long questions. So do that. It will really help. So the other trick you can follow here is also, once you read this last line, which of the following lesions patient most likely to have, you can start from the first line: mental retardation, seizures and facial angiofibroma. This clicks the diagnosis of tuberous sclerosis, so you know the answer is cortical tubers. The middle part of the question is generally the one which is not required. So the trick is, start reading from the last line, then either you read the second last line. If you do not get a clue from the second last line, read the first line. The middle part is the one which is generally, not useful. This does not follow at all. All these tricks that I'm telling you are my personal view and personal opinion. Following them or not following them is all up to you. This is just this thing to help you. So because it has helped me a lot in the previous exams, that is why I'm sharing this trick with you. These are my personal views and opinions. Coming to the next example. Again, this is a really long question. As we said, start from the last line, most likely cause is. So you know that the examiner is trying to ask the diagnosis, no complication or anything. Second last line, brain biopsy reveals demyelination with abnormal giant oligodendrocytes, some of which contain eosinophilic inclusions. So the catch points are demyelination, abnormal giant oligodendrocytes and eosinophilic inclusions. So which of these favors the diagnosis? It is PML, that is progressive multifocal leukoencephalopathy. Leukoencephalopathy, we mean that it affects the white matter, so it causes demyelination. It affects the oligodendrocytes, so you have abnormal giant oligodendrocytes, and the eosinophilic inclusions are the JC virus accumulation in the brain. PML is caused by JC virus, so the answer is PML. Now if you read this question from the first, that is 55-year-old man at home develops hemiparesis, ataxia, hemianopia, cognitive deterioration. He was taken to neurologist. MRI of the brain demonstrates abnormal T2 signal in the white matter. All of these is really not important to solve the question. The last two lines are enough to get us to the answer. So remember this trick, it is very, very important to solve the question. So the answer here is PML. Coming to the last example. Now again the trick to be followed, read the last sentence. Characteristic features of myeloid metaplasia are. So here the last line itself is sufficient to solve the question. It is not given that characteristic features of the above condition are. If it was the question like that, then you need to read the rest of the question. But here the diagnosis is given already in the last line. Characteristic features of myeloid metaplasia are. So you do not need to read the rest of the question because you've got the diagnosis already. The examiner has given you the diagnosis. When you have such question and you have to solve this question, so in that case what you do is, if the options are also long, so read the options: fibrosis of the bone marrow, fibrosis of the bone marrow, no fibrosis of the bone marrow, no fibrosis of the bone marrow. So here you can see that you can rule out two options if you know whether there is fibrosis or no fibrosis. So characteristic features of myeloid metaplasia includes fibrosis of bone marrow. It is like myelofibrosis. So myelofibrosis means fibrosis of bone marrow. So either the answer has to be A or B. No fibrosis, option C is ruled out. No fibrosis, option D is ruled out. Now read the rest of the option: fibrosis of bone marrow, fibrosis of bone marrow. The next is no extramedullary hematopoiesis or extramedullary hematopoiesis. So we know that in myeloid metaplasia or myelofibrosis, when the bone marrow is not working, then extramedullary hematopoiesis has to take place. So the answer will be B. So even if you do not read the rest of the option, it really does not matter. You have ruled out three options by the art of eliminating that we have discussed in the previous cheat codes video. So the answer is B. So this really saves time when you have long questions and long options. So myelofibrosis will have, or myeloid metaplasia will have, fibrosis of bone marrow, extramedullary hematopoiesis, presence in the peripheral blood of immature erythroid and granulocyte precursors, and massive splenomegaly because of the extramedullary hematopoiesis. So read the question from the last line for lengthy questions. Start eliminating the options. This really helps in solving the long questions. Hope you find this trick helpful. If you do, please like our video and share this video with your friends so that even they benefit from this, because sharing is caring. Thank you. Keep revising and keep winning. If there are any other tricks or doubts or queries that you have, the last moment ones where you want me to help you with, please do not hesitate to write in the comment box. I would be happy to help. Thank you.